talk about does runner's knee or patellofemoral pain syndrome, also known as PFPS, go away on its own? So, if you did not watch my previous video where we covered PFPS or runner's knee in details as to what exactly it is and what is the causes and a little more details about this condition, then you can go to my YouTube channel and you can just type in the search my name, Swati Prakash, and then runner's knee, and you'll come across that video. So this is like a sequel of that video, but if you're watching it on its own as well, I will quickly explain what is runner's knee, and then I will tell you what you can do and what is usually the treatment when you go to a healthcare professional for a runner's knee. And all right, so for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs manage their aches and pains that come from being a mom. Now, that could be aches and pains, say your neck pain, back pain, or other problems that come from poor posture or your heel pain, a weak pelvic floor that causes incontinence, etc. So there's a range of aches and pains that you can have with your joint and your spine that come from either your pregnancy, the childbirth, or in the later years when you're running after your kids or driving them to and fro classes. Now, I understand as working moms, especially executive moms, it is difficult for us to juggle home, work, travel, work meetings, etc., etc., and also pay attention to these aches and pains. That's where I come in. So I help you with easy tips and strategies that that you can manage with your everyday routine, that you can sort of merge in with your everyday routine, so they don't take away a chunk of your already valuable and your very valuable time. So, all right. So, if you have pain in the front of your knee or right behind your kneecap, you might be suffering from a condition known as a runner's knee. It is called a runner's knee because it is commonly seen in people who do running. Now, now most of the times when we have these pains, especially as busy moms, we sort of brush them under the carpet and we think, oh, it's probably going to just go away on its own. Okay, it might go down in severity, but when it comes to runner's knee, it doesn't go away on its own. So, most of the times, I would say I haven't met anybody whose runner knee has cured on its own. So, because the cause of runner's knee is usually to do with muscular imbalance or other issues that don't just disappear. So, let's see what will happen when you go to, say, your healthcare professional, your doctor, your physical therapist for runner's knee. Mostly, your doctor will obviously give you medication, but he will send you for physical therapy. Your physiotherapist or physical therapist will ask you a couple of questions, and then maybe the treatment will be one of these or a combination of what I'm going to tell you. So, firstly, you need to sort out those muscular imbalances. Usually, it's more tight hamstrings, tight calf muscles. If you're confident about, if you can tell, if you're one of those people who can tell that you have these tightnesses and you know these stretches for them, you can go ahead and start doing those. Of course, you have to make sure that the pain doesn't increase with those, right? And secondly, in runner's knee, we would see that the patella, that is the kneecap, it does not track properly. So what I mean is, when, say, this is your knee joint, this is your thigh bone, and this is your leg bone, this is the joint of the knee, and there's a kneecap sitting right on top of this. The kneecap is supposed to move in a certain way when you are bending and extending your knee. So it does not move in that particular fashion, and it is not in alignment with the knee. Okay, so a physiotherapist can help you with taping the knee. You can use a brace as well, but taping is more specific to that kneecap. So physical therapists can help you with the taping. You can ask them if they can teach you, and you can continue that at home as well. um, and also, yes, orthotics. So if you have, say, flat feet, we covered this in the previous video where we talked about the causes of PFPS or runner's knee. So if you have flat feet, what happens is your foot is sort of rolling inwards. When it rolls inwards, the outer thigh and leg muscles will try and pull it back to the outside, your leg to the outside, to maintain that balance. So what will happen is you will have tight muscles on the outside. Now your muscular imbalance that I addressed just now, that's going to cover all that. I mean, that treatment is going to cover all that muscular imbalance. However, if your flat feet is the cause of your runner's knee, you would probably need to get some orthotics for your flat feet, right? So basically, whatever is the cause of your runner's knee, you try and address that. Okay, so this is usually what your doctor or your physical therapist will advise you. Now, what can you do at home? I'm looking at my notes here in case you see me looking away from the screen. So first thing is, you take a break from all the intense activities that you're doing. Now, it doesn't mean that you stop walking or stop moving around. You can definitely do that, but if there's a certain activity, usually it's downhill running or coming down the steps, that hurts the knee even more than usual. So probably if you're doing this as a part of your workout or your everyday exercises, you probably want to avoid these actions or these activities that cause more pain. So avoid those intense pain activities, and or your intense training for the time being. A cold pack will help because cold helps to ease the inflammation. So use a cold pack. And the other thing is, you can, as I said, you can use a brace for the knee to support it. Usually the braces with that open knee would work better, but then a taping by your physical therapist, if they can teach you, that'll be even better. And the last thing is, elevate your knee. Now, if it is very severe, the runner's knee, and you have swelling, then you want to elevate your leg above your heart level to drain that swelling or the fluid accumulation, the fluid that has accumulated into your knee joint. So this is known as the RICE, that is rest, ice, compression, and elevation, the RICE principle. It is used in a lot of sports injury and other joint injuries as well. So you can do this at home. Plus, you can consult your physical therapist and then see what they advise you from there. Now, another thing is, say you have gotten over your PFPS. So I just want to quickly address what are the cautions that you should take when you have PFPS or when you have gotten over your PFPS. Your body weight. I know we've gone through Christmas and New Year's, and it's like one thing after the other, but try and manage your body weight, because whatever is your body weight will be equally distributed between your two legs, and you do not want to increase the weight on that knee, which is already uh, has got runner's knee, right? So the other thing is your shoes. And this also goes in line with what I spoke about in the orthotics part. So make sure your shoes are not too worn out. If you're looking for more information on how to tell if you need to replace your shoes, I did a blog on that. So if you go to my website and you click on the blog and just search their shoe, you will come across that blog. If you're on Instagram, you're watching me on Instagram, you can click on the link in my bio and it'll take you to a new page, and then you can click blogs from there. All right. And the other thing is, yes, whenever you get back to your activities after you've recovered from jumper's knee, or sorry, a runner's knee, or you are in the process of recovery, please make sure that you're going gradually into your activities. All right, so that's all I had for you here. Now, if you are looking for more information on how to manage your spine and joint pain, including your knee joint, you can join my free community where I do trainings every month on certain topics. So we have a lot of information in there. It's all free. All you got to do is click on this link. I'll put it in the description of the video, and you can join my community from there. If you're watching me on Instagram, again, the link is in my bio. So yeah, you can join from there. Alrighty, I hope this was useful, and I'll come up with another topic for the knee joint in my next video, and I'll see you guys then. All right, bye for now.